We are so glad that you're here with us. This is the last session of the last day, and after this, we go to the closing ceremony and plenary session. So thank you for joining us. Before we dive into everything today, Larry, Melissa, if you don't mind, I wanna test something out. I want to start off with a bit of a baseline, and you'll notice, and hopefully you'll have a dry erase, whiteboard paddle on your seat, and also a marker. Please make use of it. We'll be asking you to make use of the paddles, at a few points throughout our session. But before we get started, I just want to take the temperature in the room and maybe just have us check in with ourselves and with each other. So, let us get started then with a very simple question, which is, how are you doing today, right? How are you doing? What are you feeling right now? Use your paddles. Go. You can keep it very simple.
Words. It's feeling words, right?
Feeling words, emotions. Yep. And then just put them up. Tired. Yep. Yeah. Lots of tired people. Cold. Yeah. Inspired. Hey, we've got inspired. Challenge. Oh, full. Energized. Another full. Spent. Oh, super. I'm not sure I can even read that, but I believe it. Tired too, excited, okay, fulfilled.
Hopeful here.
Hopeful.
Hopeful.
Oh, thanks, Larry. Grateful, chilly, FOMO. There you go. Yes. Content, full brain, satisfied. So all sorts of answers. So thank you for that.
Overwhelmed.
Overwhelmed. So consider this next question then, right? And slowly trying to go into the topic of our workshop today. How do you feel people living in poverty right now might be feeling? Yeah. Feelings, emotions of people living in vulnerable conditions, in vulnerable contexts. If you can think of some, then please share them. Overwhelmed, right? Stressed,
hopeless.
Cold, hopeless, forgotten, frustrated, sad and lonely, desperate, empty, lost. Thank you so much, all of these. Stressed, tired, some happy, some lonely.
Yeah, very good.
Yeah. Excited, terrified, numb, fearful. Thank you so much.
Hungry.
Hungry. Yeah. Thank you so much for sharing all of these feelings and emotions with us. Next question, right? We're ready for the next question, which is, in one or two words, what do you think poverty is? Keep it simple. Keep it basic. Give us a word. Give us two. How would you put it? Lack of options. Lack
of
no
access.
No choices. Lack of access. Less opportunities. Unfair, unjust. Less things. Poor narrative. Under-resourced. Scarcity. Scarcity again.
Can I hear from poor narrative? Can you explain that?
Yeah, because we are using extractive. Hi. Zoe.
Hi, Zoe.
We just had an excellent workshop here that talked about the power of storytelling and how we need to get better about our storytelling. Because even using the word poverty, the poor, it's a narrative shift that we have to stop using.
Thank you. So
Thank you for
unable to thrive here.
Unable to thrive. Used. Colonization, constant desperation. Yeah. So another final question, at least from me, right? One final question, which is, who do you think owns poverty? Who's the owner of poverty? You can think about, it just and keep it to yourselves, or if you want to write it down and share it with us, feel free. But it's definitely something that we want you to consider, to reflect upon, to maybe ponder a bit.
Emily says everyone.
Everyone.
Good. Yeah.
Everyone. Community. Everyone.
The storyteller.
Storyteller. Yes. I mean, all of these are really, really good answers. So thank you for sharing, your insights with us. We feel that, or we not only feel, but we find that the question of who owns poverty is just a much less common question, right? But we feel that it's an important one, not because we want to pass off ownership or we want to pass off blame, but because we simply feel that it's important to recognize, to acknowledge that no one has really taken ownership over the problem of poverty, and therefore it is a problem that still needs to be solved, right? It is in fact the number one sustainable development goal, right? We know that we're not gonna make it by 2030. We're gonna be kicking it down, further down the line, right? And so who do we think owns the decisions around poverty to be made, right? And for us, it's important to recognize, we need to be able to recognize the importance of having families, living in poverty, living in very vulnerable situations, to be able to define for themselves what poverty means to them, but most importantly, what they can do about it. Yeah. And, and we can, all the rest of us, we can support them in that process. But it's also about thinking, how would they put it? What do they think it is? And what do they think they can do about it? So let me try to move on with our slides, because we are running on a tight schedule here. So the Poverty Stoplight is really trying to get to this, question of who owns poverty by trying to put the family, right, the individual, the person living in poverty at the very center, right? From the moment it was designed, from the moment it was developed, what we have been trying to do is we have been trying to bring poor communities to the table, to bring their voices in, to try to listen to them, to try to learn with them, right? And from them what they think poverty is, right? And, what information, what data they need, sure, but what support, what coaching they also need in order to improve their situation. So the Poverty Stoplight, in that sense, it's a visual, it's a very practical, it's a very simple, multidimensional poverty measurement tool and coaching methodology that is seeking to activate the potentials that families already have, that each of us already have, right? So that they can find their own individualized paths out of poverty, their own self-directed paths out of poverty. And it does that through the Poverty Stoplight platform, a tech-based platform that offers them a self-assessment, a survey, but also an intervention model that will help them, support them in finding their own solutions, right, to work their ways out of poverty. And so how does it work? Well, it's really very simple, and it starts with the family at the very center. We invite families to take a self-assessment, survey that is going to take them through different dimensions of quality of life and well-being, so that they can try to understand all of the many and different ways in which poverty is having an impact, on their lives, on their households. Right? And it's going to do it by using the colors of the traffic stoplight, right? Where a situation of red is a situation of extreme poverty, something that is yellow is a situation of poverty, and something that is green is a situation of non-poverty. And at the end, we will be walking them through, or they, as they take the survey, they will be walking through 6 different dimensions of quality of life that of course include income and employment, but even other things like education and culture, like housing and infrastructure, like health and the environment, like organization and participation, and even some more subjective dimensions such as motivation, self-esteem, right, ability to make my own decisions. By the time they are done with the Poverty Stoplight self-assessment, instead of them being given a number, a statistic that they can't really interpret nor do much with, they end up with their family stoplight. They end up with their life map that is simply going to use the colors of the stoplight to show them all the different areas in which they are already doing well, but equally important, all of the areas that they can still work on and improve, right? So it's very, it was built on purpose to be made very simple, very intuitive, and to then from this heat map that they are, that they get at the end of the survey, they can then start to make their own decisions as to what, perhaps what yellows and what reds they would like to work on as a family, as an individual, and make those decisions. And we'll have people typically on the ground, mentors, coaches, extension officers that will facilitate that process, and then will support them in that process. Yeah. But of course, the Poverty Stoplight is not like some of the most common poverty measurement tools and methodologies, right? We know that some of the main ways that we have to measure poverty are in fact quite different, not only in the way that they define poverty, but also in the way that they then determine who can qualify for aid. So for instance, while one family might qualify for aid according to the metrics and the standards of a local NGO doing work on the ground, they might not necessarily qualify for aid when it comes to the government-run programs that are working on anti-poverty measurements and interventions. The Poverty Stoplight is based on the premise that poverty is multidimensional, so it goes much more beyond only thinking about what we have or might not have in our pockets today. It really needs to think about, in a much broader way about all other areas of, quality of life and well-being. And in that sense, it also, it's also different from other anti-poverty metrics out there, because it starts with the family. So it is, so instead of being, top down and extractive, when we are extracting information from your family, we then leave, for instance, when they come in to do a census, and then they leave for, with all of our information, and then we never get it back, right? Or if it ends up with an actual index, with a statistical index, that again, it's a number that we can't really interpret, that we can't really do anything or much with. The stoplight, right? The stoplight starts with the family. It is based on the perception of the family, on the understanding of the family. It is self-reported data that families can actually, make decisions based on their Poverty Stoplight, and they can decide for themselves what are some of the ways that they want to improve their situation. And in order for this work to be effective, we really need to understand that not only the recipients of anti-poverty measures, but also the providers of these measures, they need to be working hand in hand, and they need to have the same understanding of exactly what are the root causes of poverty. And so over the years, we have developed a strong network all across the world. We have a reach at the moment in some 59 countries. We have just under 580,000 families that we are working with worldwide that have taken over 1 million stoplights with us, and this just happened last week that we got to our 1 million stoplights, so we are very excited and proud about this. We are working with more than 1,000 partner organizations, and we brought here today two of our most valuable and important partners to share with you what this is all about. And our partners are what make our global network. This is where we are really trying to work together to of course talk about the challenges in this type of work, but more importantly, how can we develop solutions together, right? And what are those solutions? And work with the families to understand what those solutions are, right? And partners are really vital. They are key to the success of the stoplight, because partners are the ones that have established trust in the communities, that have those long-standing relationships. So they are able to go to the communities in order to engage with them, right? And as the stoplight integrates into their operations, then they can not only measure the impact in a much more detailed and granular way, but they can evidence their impact in a way that is much stronger. What our partners are telling us, and you'll hear from our partners in just a few minutes, what our partners are telling us is that by using their stoplight, they actually were able to get much more refined, a much more refined understanding of the realities that the communities they are serving are actually facing, right? And this having the stoplight data inform their decisions of what type of programs they should actually be putting on the ground, right? What are the actual needs that the community have? So really being able to do that match of, supply and demand in a much more effective manner, and making those investment decisions in exactly what to develop and why they are developing, driving those decisions based on the data that they are getting on the stoplight and not on mere assumptions. So this is a bit of what the stoplight is and how it works. But to illustrate all of this better, I want to invite Larry and Melissa. Again, they are our partners. Larry from Thrive Lights here in the U.S. and Melissa Velazquez from Unbound, working in 17 countries around the world. So please, Larry, Melissa, take it away. And yeah, thank you for being here with us.
Thank you, Julia.
Me.
So we're going to have you go through an exercise of seeing how this individual agency actually works. So we're going to give you different people who have followed the stoplight. Now, we're not, I've used made-up names for the ones I'm going to present, so we don't share people's private data with everyone. But it's for you to get a perspective of how this human agency works, how people make their own choices. So you're going to see different examples. Melissa and I will give you different examples from different parts of the world and different types of organizations. And then we're going to ask you to get into groups of 2 or 3 or 4 and decide if that was if those were the indicators for you, what would be your priority? What would you choose to work on? You can choose up to 3, but choose priorities, and then one of you write it down on your paddles, and then we can see, and then we'll show you what the person actually did. So that's what we're going to do. Let's move to the first one. So first of all, to explain, as you saw from Julia, these are the different indicators. Now, I've abbreviated it because there's up to 40, and you can't see them all when you get a lot of them. So this is a woman, I'll call her Esther Banda. She is in Cabarrus County, North Carolina. And she's been called to meet with the head of the Department of Human Services. Her name is Karen Calhoun. Karen has been given a child endangerment report on Esther because a police officer found Esther living with her 6 children in her automobile. So first question, if you were Karen, what would you do when Esther is in front of you when you're talking to her about this child endangerment report you have? Your choice is let the children stay living in the car with their mom or put them in foster care. And you know that long-term results of foster care are not very good for the children. So what would you do in this situation? Any thoughts? Yeah, so Karen has been through this many times, and she doesn't like those options. She doesn't like them at all. So she has Esther take the Thrive Lights assessment to find out what's causing the children to be endangered. Why are they living in their car? And so she finds some interesting things. Yellow on income, not red. So she finds out Esther actually has a job and goes to her job every day. Nutritious diet is red because they're living in their car and they have to go to fast food places. Addiction, her husband has become addicted to opioids. When he can't get his drugs, there's violence in the household, so she's left to keep her children safe. So she doesn't have housing, but her kids are still in school. She still gets up, gets her kids dressed, and takes them to school every morning and then drives to work. So get together. If this were your situation, what would you prioritize here? You can pick up to 3 of these indicators that you would most want to work on at this time. All right, let's see your paddles. Safe housing, part of a community. So part of a community is interesting because part of the reason she's in her car is she doesn't have community nearby to help her. So several of you have that. Safe housing, part of a community, family savings, okay? Housing income, so you want to make sure that this doesn't go away. in the middle of all this, and then high school. Yeah, keeping the kids in school. Yeah, yeah. Community housing income. Okay, so let's see what Esther chose.
Yeah, let's see it.
So Esther chose healthy diet, not held back by harmful behavior. So this is addiction. She wanted her husband to get into rehab, and then housing, safe housing. So what happened in this case, because Karen had seen these before, she had reoriented her whole department. When they moved new offices, she created what she called her dream center, which she created space for all these nonprofits and medical organizations to be co-located with her. And so what she did after going through these priorities with Esther, she got up and walked her through the offices to the different places to get her lined up with the resources she needed. And Karen told me on those three and any others, she said by that evening, by 11 o'clock that night, they had the family in a new place, in an apartment, with beds, with food, with utensils. They had everything lined up because the whole community got together, like you said, part of a community. The community of nonprofits and saw the situation, and they all got together and got her what she needed that night. And so let's go on to the next slide. This is the longer term. So what happens, her achievements, they have the safe house, they have nutritious diet now because they can cook in this place. Her husband has got into the rehab program. When I talked to Karen last about this, she said there's been a few ups and downs there with that, but they're still together, and they're turning the yellows and reds into greens. All right, so Melissa, we're going to another country now.
All right, yeah. So as was already mentioned, Unbound works around the world in 17 different countries with a group of community-based organizations. So all of the members of our movement are locally based community organizations working to tackle the challenges of poverty in those particular communities. However, we are a global movement, a global organization. And so when we think about 250,000 families around the world, how can we personalize and really address unique needs? So that's where the Poverty Stoplight for us has become just a critical tool to, again, decenter our program and recenter the individual families and communities. So we're gonna take a quick trip to Uganda. So this is a family in Uganda. Pauline, in this case, is living in a rural household. There's 6 members of the household. They make a living farming, and the adults in the family have a primary school education. And this is the output of her first Poverty Stoplight self-assessment. So I know that these indicators are small from a distance, so I'm going to call out a couple of them, but if you want to come forward to do your exercise again, please be welcome. So the first one that is red is we have enough income, but then you'll see a lot of yellow here in access to credit, savings, diversity in income, identity cards, eating a balanced diet, but there's also a whole lot of green here. There's a lot of strength. Pauline is part of a group. She solves her problems peacefully within her family. She knows how to petition the authorities for certain resources in her community. So there's a lot of green, and that's another fabulous thing, is there's a lot of assets here that she's able to self-identify in order to plan her strategy, not Unbound's, but her strategy to overcome her situation. So again, we're gonna do the same exercise. I invite you to chat amongst yourselves, move forward if you need to see, stand up and walk around if you need to. If this was your stoplight, if you were Pauline living in this situation in Uganda, I don't know, do we have anyone who is from Uganda in the room? I know that that's a reality in this conference, so that's excellent. I don't think we do. Raise your hand if, okay. But if you were in Pauline's shoes, what might you choose? Talk amongst yourselves and write your top 1 or 2 priorities on your paddle again, and I'll give you a couple minutes to do that. All right, I know this seems to be stimulating some good conversation, but I'm gonna call us back. So if you haven't written something down, please go ahead and just again, there's no wrong answer because it's not our decision, right? At the end of the day. So go ahead and jot down what you think you might put there. And we'll take a look. And while we're doing that, somebody made an observation, which is excellent. There are a lot more indicators on this stoplight than what Larry just shared. Now, I think, Larry, you were sharing an abbreviated version, which is great. But also, it is true that the indicators are different in different contexts. Because again, does being poor or thriving in Uganda look the same as thriving or being poor in, sorry, Larry, what was the city that you mentioned? North Carolina, but in the state of, you're right. So again, the whole process of the Poverty Stoplight is actually building the self-assessment with the engagement of the community. So not only do local program staff identify the indicators based on collaboration with the Poverty Stoplight team, but focus groups of women and community members come together and say, what does it mean to be not poor in Uganda? Well, to me, it means that we can access credit, we have enough income, we can manage our garbage responsibly, et cetera, et cetera. So these are built based on the community. But I'd love to see your paddles. So there is a lot of work to harmonize at the national level because there are things like national poverty lines and certain contexts. Sometimes there are some differences, urban and rural communities, but it's generally at the national level. And there's a lot of indicator sharing amongst the partner organizations that Julia mentioned to try to, again, harmonize, not necessarily standardize, but harmonize those indicators to really identify what it looks like. So it's contextualized, but not per neighborhood or per community, if that makes sense. But the decisions based on the stoplight are then made at that level. So let's see the paddles again. Sorry, we got, but thank you for that question. So I see diverse income, I see safe housing, solving problems peacefully, access to credit. What else do we have back there?
Income, budget.
Yeah, we see budget, health access. So another thing you might have noticed too is that there's actually not a whole lot of red here. Again, yellow means poverty, red means extreme poverty, but already it's rupturing maybe our assumptions about somebody in North Carolina versus somebody in Uganda. And Julia, do you have the clicker? Okay, thank you. So let's see what happened here. So this family chose to prioritize managing our garbage responsibly, having a safe home, having a dish rack, and having an improved toilet. So those are the 4 priorities.
Dish rack on anybody.
Did we have a dish rack out there? No, okay. I love this example because, again, it reminds us of what is important. So any ideas as to why a dish rack might have been a priority for a family in Uganda over some of these other things? And look, we have enough income, didn't even make the priority list. So in Uganda, having a dish rack means you're able to elevate your cooking utensils while they're drying. And that is critical, especially in rural farming communities, for maintaining hygienic, preventing disease, preventing transmission of bacteria and other viruses and diseases. And so that is actually a critical first step to other access to healthcare and other things. So again, I wouldn't have known that. Most of us in this room maybe think we have some expertise in the area, but we wouldn't have known that. But Pauline knew that, and she prioritized that. So that's what was fantastic here. So let's go to the next slide. So in 2024, I mentioned this is her first stoplight. So then in 2024, the next year when she took this self-assessment again, she had achieved managing responsibly their garbage and the dish rack. So you can imagine how that is a critical root cause for other health needs and other issues in their home. And income is still red, so that's an interesting one. But remember, this is a farming family. They are most likely subsisting off of their own agriculture. So maybe income at the national poverty line in Uganda wasn't as critically important to her as a family. I think I have another slide here to show the next set of oh no, I didn't, sorry. On the next example, we'll look at some more priorities, but we'll pass back to Larry.
So we're coming back to the U.S.
So back to the U.S., San Antonio, Texas, and this is a man, I've given the name Sebastian. Sebastian is, he works at the Zachary Corporation. So we work with both nonprofits in the U.S. and with for-profit companies. So you might ask, why would someone who's employed take one of these Thrive Lights assessments? Our theory of change looks at how poverty happens in the U.S. If you look back over the last 50 years, poverty levels have always been between 11 to 15% of the population. Hasn't changed. And so you think, well, we must be failing. But in fact, nonprofits and government programs help 30% of those people rise out of poverty every year. So why isn't the number going down? Any guesses? Yeah, the same number of people enter poverty every year. And a large portion of those, about half of those, are people who have been employed who lose their employment. And so we find if we can work with companies to help them understand what is going on in their employees' lives outside of the workplace that may end up with them not being able to work or not being able to show up to work fully productive, then we can stop this slide back that happens so often in our country. So this is Sebastian. Again, it's a shortened version of these, but he is yellow in income. So he's a laborer in a road construction company. He doesn't have any savings, doesn't have any estate planning, knows there's something with mental health services that the company provides, but he hasn't really used it. His diet isn't good. His housing is at the surviving level, but not thriving. English literacy is low. His kids are in school. He has some community, but not a lot. His emotional well-being, he says, is yellow. Okay, so if you're Sebastian, what do you choose to work on here? So we've got English, healthy diet, part of a community. Literacy, community, safe housing. Literacy, emotional well-being. English literacy, safe housing. Okay, we've got a savings here. And what do you have, Eddie? English and mental health. Okay. English, community, and diet. Okay, literacy and diet. English, healthy diet, mental health, literacy, savings, mental health. Okay, let's see what he did. So his first choice is estate planning. So who had estate planning on there? Okay, nobody. This is something funny that the Zachary team didn't expect, but they found that when people took the survey, they actually had a large number come up with estate planning is something, because it was something people hadn't thought about, and having to look at that and realize they were red. People said, well, I want to take care of my family. I better do something here. And the company actually had to, well, they went and created another benefit for their employees. They got in a partnership with an organization where the employees can just call them, go through an interview, and they generate the papers for their wills and whatever they need for them. So he started with estate planning, but then he started thinking, okay, if I'm going to take care of my family, I need safe housing and English literacy. So many of you had those things as well. The person I talked to at Zachary said he finds that estate planning is sort of the gateway to a lot of other things, because it causes people to think of the future in a different way. And so they work their way backwards to, okay, what do I need to start doing now to change things? And so let's see what happens. So he not only does the estate planning, but he also starts to increase his savings. He got into a training program that the company offered so he could get a certification so he could start earning more money. So those things go up. He enters into a training, a budgeting class that the company offered. The company also takes this data and shows, they go work site by work site and show the employees their aggregate data, and then shows the common priorities among the employees and asks them, come up with a project for what you can do together to help. So his group worked on savings. They all set savings goals, and they all pushed each other, and they all started capturing, what are you doing to save? What are you doing to save? And it created this this dynamic atmosphere where people were working together. His foreman said, okay, I guess I'm going to have to stop smoking if I'm going to get my savings goal. So there are all these sort of positive energy that happened because people were working together to address these challenges.
Melissa, where are you taking us now?
We're going to head to Guatemala. So this is Doña Carmen, and she is a woman in her 30s, living with her spouse and her children, and they're currently in shared housing with her extended family. And I actually got to visit Doña Carmen, and she has a printed copy of her life map, which is the output here that you see, that is coming from the Poverty Stoplight self-assessment again. So now you can see the indicators are a little bit different, again, contextualized in Guatemala. She has a few reds in savings, separate bedrooms, but she's also got some yellows, but she has a whole lot of green as well. And we'll see how that plays out in some of the things that she prioritized. So again, you know the drill now. Take a couple minutes, jot down your top 2 priorities for Doña Carmen and her path out of poverty. All right, I see a few people holding up their paddles already. Excellent. All right, I see TV and internet, so access to information and entertainment. I see budgets, balanced diet, being part of a group, separate bedrooms and savings, a balanced meal, being part of a group, budget, income, excellent. All right, let's see.
Health services, right? And internet.
Excellent, excellent. Yes, let's see what she prioritized. Okay, so we can see here she has prioritized income, savings, and separate rooms. Sorry, it flipped to Spanish because I didn't translate this one. And of course, each of the stoplights are in the local language. But those are the top 3 indicators that she chose to work on. And then let's flip. I think this one, I do have the 3rd slide here. So again, in her second stoplight, she was able to achieve many things. She was able to now be green in savings. So she has, she's thriving in the area of savings. She has a budget. Their family is now eating a balanced diet. And you'll see also group participation went from yellow to green as well. And she has also prioritized some new indicators. So there are a couple little pins up here. So now we have enough income is a new priority for her. Our home is safe, and we have separate bedrooms. And I can tell you from visiting her, so one of the areas that she was green in, you might have seen from the beginning, is self-esteem. And she was the most excellent expressive leader, and she knew that she had a skill in culinary arts, and she wanted to sell food, and she knew that that was her path to getting enough income, but before she could do that, she needed to understand her own budget. And in order to do that, or in order to understand her budget, she was then able to focus on savings. So it was so clear in her mind how she was able to incrementally eliminate these different dimensions of poverty in her own life and get to a point of thriving in each one. And the other super smart thing that I would wish I was better at this, when she said, I want to show you my savings. And I was like, okay. And when we went to her house, showing me her savings was showing me the stacks of brick that she was purchasing incrementally with her savings, stacking it up outside her sister's home so that she could build on her separate rooms. So she wasn't going to take any risk that savings got diverted to other purposes while she was waiting to build her home. So she is on her way to not only having enough income, but having that safe home with separate bedrooms. And again, that's another contextual decision-making piece. So I really want you to see there that just valuing her leadership and her decision-making is more aggressively and more appropriately and more relevantly moving her in the right direction. And then the organization can just support, in our case, through community organizing and cash transfer, again, putting the decision-making power in the hands of the family and the community to really mobilize in the direction that they want to go. So I think our next, we're going to move on. Oh, yes, go ahead. That's an excellent question. I'm going to repeat it just so that everyone could hear. So the question was seeing something go from green to yellow. And this is the one I think you called out.
Yeah.
So great observation. So the poverty stoplight is a lot about awareness as well. So as families are looking at their situation, and you can imagine if you've ever done assessment tools with individuals or evaluation, sometimes we are inclined to answer one way, sometimes we're inclined to answer another way. I cannot tell you in this particular case, because I wasn't there for the different stoplight taking, but I do know that in some cases it's a lack of awareness the first time. Like, oh, I thought I was fine in that area, and then I realized that I actually have an issue. Or sometimes it's contextual in the sense of, especially with safety issues of violence, sometimes things happen. So one of the indicators is, in the past 6 months, has my home been broken into, or have I lost my possessions or something like that? So it could be something that happened recently to the family. But good eye. And sometimes we know poverty and development is not linear. All of us know that. We go back, we regress in our goals. And so again, this life map is dynamic. So it is a process of reassessing every few months, every year, going back and looking at where am I and what's my next move? Where do I want to go to next? Sometimes it's our social context that also helps us be aware and helps us desire a different move. So, I mean, we've even seen situations for sure where even things like housing and a toilet, having a hygienic toilet may have not initially been a priority because, well, everyone in my community has the same kind of toilet I have. So I didn't see it as a need or see it as a priority. But as I grow and as I also see the progress of my community and my neighbors, I also want to have that for my family. So there's also that desirability concept that comes into play for sure.
Yeah, I was just wondering, well, first of all, what I'm trying to figure out is the self-assessment. Are you seeing big changes or differences between countries or gender or urban versus rural? And also when you mark something as red, yellow, green, right? Is there a greater likelihood in different countries where someone might call something yellow, or who determines red, yellow, or green? So they're two separate questions, really. But
Right, and maybe I can answer the first one, the who determines what's red or yellow or green. Again, it's the same in the process of establishing the indicators for the stoplight. There is adaptation process that happens where each of the communities is going through that process of, in this community, in this country, what does it mean to have a safe home? Well, it means that we have doors that can lock and we have windows that shut and nobody has been broken into in the past, whatever. So they're defining what that indicator looks like. And so they're just saying what is yellow, what is red, and what is green. And in a minute, you're going to get to experiment with some of the stoplights and get to see what that looks like. So I'll maybe let the rest of that question sit for a second, if that's all right. So what we're going to do next is we're going to move into a demo process. So again, as we just mentioned, the surveys are contextualized. And then even, in Unbound's case, for example, there are a set of standard indicators for the country that are, again, shared through the stoplight network, the stoplight partners. But then there are sometimes additional indicators that are added for specific contexts and community needs. So if you scan the QR code, you'll get a choice of multiple surveys. These are all demos, so they're kind of shortened versions, except for the first one. This first one is in Telugu. It's from India. You will see it in Telugu script and images. So we may be lucky and we may have someone in this room that can read that script. If not, I just wanted you to be able to see that, again, the whole survey is focused on the user and focused on being able to access through images and through local language the different indicators. We're going to walk around and help you out. Feel free to take the survey. They're all demos. You'll see that there's like a consent page because we want you to understand that, again, the data for the family, they own that data. They own that decision making, but also we want to make sure that there's data privacy because that's all being gathered together through the service, through the platform. Your data will be deleted because it's in a demo module here, but you'll see those windows to click through. And we'll walk around and you can answer it for yourself. You can answer it as if it's a client or maybe a participant or a program participant that you work with, just like you were doing for our different story examples.
We're all experiencing poverty in some level. Right. So it doesn't matter how much income you have. We all have areas where we're experiencing some level of poverty and things we need to work on, and we need community support to help us work on them. So it's, in this way, the tool is sort of equalizing. It's not just looking at income poverty, but where are we strong and where are we lacking?
And so like if we were interested in, let's say, partnering and deploying the tool, but like I would need to know that it's a relevant tool for the community that I work with. Like, do you have that methodological background like available for folks?
Right. We would work with your community, with your team, to work with the community to go through this process of what does thriving look like for your community.
Okay, so you would, like within an individual country context, you would do the adapting
Right.
for the community. But I heard that there was still like, at a national level, there's value in having there be a positive symbiotic relationship between an individual community's tool and like what's happening in other communities across the U.S.
Yeah, and what we find is a lot of times the type of indicators are the same. The levels vary a lot between locations.
Okay, so you like start with the standard tool and then do a facilitated adaptation
Right.
process. Okay.
Right.
And then there are some indicators like income levels that are set at the national level, right? So U.S. will have its own poverty line, Paraguay will have a different one, and every country will have its own standard. So then we need to go by the national guideline. But when we first start working with partners around the world in different countries, the first thing that we do is we go through the adaptation process of the Stoplight survey with the partners and have it validated through focus groups and with the community so that we know that it's relevant to where we are intending to use it.
Yeah, the point of relevance, I think, has really been, even for myself in these discussions this week, really thinking again about if our goal is for impact and change to happen in communities, then who should be deciding what that change and impact means, right? And so when the production of data, the analysis of data, and the decisions about the data are made at the family level and the community level, it changes the whole dynamic. And so that for us is a shifting of power away from a centralized approach to a very decentralized one.
And instead of aggregating data in a single index, we are literally disaggregating the information, and we're showing you, okay, this is the map of your life. This is how you are doing based on what based on what you are telling us, based on what you are saying. It's your perception of your own condition, your family's condition.
And what we find then is, as people then can look at their aggregated data together, groups can see, I'm not the only one with this problem. Others, and they can also see, oh wait, somebody's green in this area where I'm red. Maybe someone can help me out here. So there's a lot of power in bringing the data back to the people and letting them make decisions and letting them learn, and not extracting it for other people to make decisions about them, but for allowing them to choose for themselves and then to see and learn from the data they've provided. Good.
Is there ever an opportunity, or does it make sense to, if somebody doesn't see the relationship between this choice and I'm going to use a word like the domino effect, for example, if I do this, these 5 will fall or be improved upon. Are there coaching for that? Is it just completely left up to the person? Like, can you explain a little bit of like what that looks like, or if that's important or not?
In most cases, this is done with a facilitator that will help walk through some of those. But the facilitator's job is to help them make choices, not to make choices for them.
And I think, in different contexts, whether it's a social worker that's working with an individual, or in our case, both social workers and community groups. So there's a mutual support group for individuals to tackle those different challenges. There is an ongoing follow-up, a mentoring and a coaching, whether it's peer or whether it's with a professional in a particular dimension.